Chuck, can you hear us?
Now I hear you. I'm still chuckalicious.
All right there. There may be new hope for those with a tough-to-treat form of lung cancer. The disease is called ROS1 positive. It's a non-small cell lung cancer. It tends to be very aggressive and can often spread to the brain. Joining us to talk about a new FDA-approved treatment option are Dr. Jason Porter and Ms. Janet Friedman Daly. She's the co-founder and president of the ROS1. Is it DERS? DERES? Well, how does that, Ms. Friedman
That's
Daly?
correct.
Yeah. Dr. Porter, just to get this started on this, we were talking, and there's some of us on the screen that remember the word lung cancer was a death sentence. There was no treatment, there was no options. What is non-small cell lung cancer, and what does it mean to have ROS1 positive diagnosis?
Right. So non-small cell lung cancer is the most common type of lung cancer, which means it originated in the lungs. And to have a ROS1 positive non-small cell lung cancer means there's an abnormality called a fusion in the gene ROS1 in those cancer cells.
Well, let's be clear. We used to think that if you were diagnosed with lung cancer, that you were a smoker, a former smoker.
Mm-hmm.
But that's not really the case. We are seeing people developing cancer from other issues.
Right. So the most common type of patient that we see with this ROS1 positive non-small cell lung cancer is usually younger females. Most of those patients didn't smoke in the past. And so we see these gene mutations or alterations that are actually driving the lung cancer for these patients outside of smoking and the more common things.
Can a lot of this cancer found in females, can that be attributed to secondhand smoke or secondary smoke?
So usually not lung cancers like ROS1 positive non-small cell lung cancer. We can definitely see lung cancer as a consequence of secondhand smoke and other occupational exposures, air pollution, and then also radon exposure in our environment. But alterations or fusions like ROS1 usually are not secondary to secondhand smoke.
Dr. Porter, let me ask you this. How do doctors determine if a patient has ROS1 positive diagnosis? What are the steps to get to that outcome?
Right, so usually we diagnose lung cancer with a biopsy, and then we take the genetic material from those cancer cells, and we study it in a lab, and we can find abnormalities like the ROS1 fusion.
Now, it seems now there has been some progression in how we treat lung cancer, especially, and battle that disease. Can you tell us more about this new treatment?
Right, so the FDA recently approved a therapy called Augtyro or repotrectinib, and that's by Bristol Myers Squibb, with whom we're here today. And it's approved for adults who have non-small cell lung cancer that's spread within the chest or to other parts of the body, and is caused by that abnormal ROS1 gene. When patients receive the therapy, they can have some side effects like dizziness, but the side effects are unique to each patient. And so if you're having side effects, you really need to just talk to your provider about it. And you can learn more about the therapy at augtyro.com. That's AUGTYRO.com.
Let's bring Ms. Freeman Daly into this conversation. Ma'am, how significant is this latest approval for patients and their doctors?
Well, it's very significant. I'm not just a lung cancer advocate. I am also a ROS1 positive patient. When I was diagnosed in 2011, and at that time, you've mentioned that lung cancer was a bad disease. At that time, about half of patients died within the first year. But thanks to biomarker testing that can detect ROS1 and targeted therapies, that's changing. However, cancer is smart. It adapts and finds a way around treatments. And that's why having new treatment developments is so important to us, because it gives us more time with our families.
How would someone know that they would even need to ask for maybe this biomarker testing or whatever other kind of test would be required? What would you want to be looking for within yourself?
Well, it's very important when you have lung cancer to be a patient advocate for yourself. You need to be able to know what questions to ask the doctor, and any patient who has non-small cell lung cancer should ask the doctor about biomarker testing. You can learn more about ROS1 on the website, theroswonders.org, and I'll spell that for you. THEROS, the number 1, DERS.org.
To me, really, cancer's devastating no matter how you get to it. But is this ROS1, this is putting a new perspective on how we're looking at cancer overall. I mean, it can mutate into cancers in other parts of the body, can it not?
So
Yes,
we
it
know
can
that-
spread.
Oh, you go ahead.
Go ahead, doctor.
Well, I was just going to say, we know that once, you have a diagnosis of cancer, it can definitely spread to other parts of the body. But what we're learning with biomarker testing is that each cancer is different. So each patient may have the same diagnosis, but what's driving the cancer may be very different. And when we know what drives the cancer, we can very, very precisely treat those cancers. And when we're able to do that, those patients usually do much better.
It's like Miss Janet
And-
said, cancer's smart. Go ahead, Miss Janet.
I was also going to say that with these cancers that are driven by ROS1, being able to be on a targeted therapy means that you have fewer side effects and it's easier to deal with than being on chemotherapy. Thank you for having us.
Anytime, anytime. We thank you for the great information. And once again, we want to let people know there is hope. There is something in the battle against cancer. Do you have time for one quick question for both of you?
A quick question now.
Yeah. We live in a world where we try to live a preventative life. We try to live a lifestyle or do this. Are there things that we can do in our lifestyles, how we live our life? Of course, not smoking is one of the first, but are there things that we can do health-wise, diet-wise, environmentally, that can help build immune or help us battle something like this, the possibility of getting this?
I don't know
think-
that there's a quick answer to that.
Right, there's not a quick answer, but I think that the most important thing is, even very young, to stay engaged with the doctor and let them do exams and screening so that you get diagnosed with things early and they're easier to treat. Thank you so much for having us.
Anytime. Y'all have a great day. Thank you for the great information. We really appreciate it. Have a great day.
Thank you.
Wow.